Okay, just to everybody, I hope you won't use it now, but in case you want to reach the internet, it's Masada Guest. You can see it, and it's 1 to 8. Okay, now we are missing the view, but we'll get the real lectures and then the panel. And I want to invite Professor Yoav Ennis, the Vice President for Research and Technology and Research and Development, R&D, at Tel Aviv University. Technology is included. So please, Yoav.
Thank you, Mira. First of all, I want to clarify that I am not against technology. I want to welcome everybody here, all the people from Tel Aviv University, from other universities, from the research of the Arava, and of course all the guests and invitees from abroad. We are very glad to have you here, and we hope it will be a successful and good starting point for the meetings here. I am filling the place of Udi Gazit in this presenting this session. So I did not prepare anything special because usually I start with some jokes. So I did not prepare, but I can take something from the sleeve. What I can definitely say, we have a bright future because from this place we can only go up. Okay? But on a more serious level, so we have here a series of talks. And the first one is going to be on skin diseases. And of course, the Dead Sea is a known place from where there is a lot of medical tourism around here, where people come from all over just to go to the Dead Sea to get the skin in better conditions. And actually, if this will happen to work well, maybe the Dermatologist Association will file a suit against the Dead Sea and its use for curing skin disease. So we can hear about the advance in that in the first talk by Dr. Marco Harari, who will tell us about advanced human studies and treatment, why at the Dead Sea. So, Dr. Marco Harari, please.
So, ladies and gentlemen, of course, I'm very proud to be here. Maybe the reason why I'm the first opening here is because I'm a very old physician here at the Dead Sea. I'm the white wolf here at the Dead Sea. I just want to tell you that I'm affiliated to the Dead Sea Research Center from the beginning. And in order to make it short, I would like to say that all the thanks are for all the people sitting here, of course, but especially to Mrs. Yael Maor, who was at the beginning the first visionary of this project. So thank you very much for having you here. I would like to explain to you why we have to stay here and why we have to do some studies at the Dead Sea. The reasons are very simple. I would like to finish my presentation in one slide. You will see this very quickly. One of the reasons is because, of course, the changes that we see on patients from years, as I told you, 30 years I'm working here, are very dramatic, very fast. In 2, 3, 4 weeks, patients coming here with skin diseases are totally cleared. The second point is the fact that we have also people that are not sick, thanks God. Not all are patients here at the Dead Sea. And we can, of course, for patients and for people healthy, we can use this data of patients, of people not patients, to make comparative studies. What we did, of course. The third point is also important here to highlight. I'm privileged to work here at the Dead Sea Research Institute and also in a clinic, in a facility in which we have patients coming, and the proximity of the laboratories and the clinic is exceptional. We don't have to move a lot, we don't have to ask questions, we are together working at the same place. Lastly, we know almost everything about UV radiation, barometric pressure, the winds, the pollens, the aerosols in this region. So we know exactly what we are doing here. We have the possibility to explain the change in this. So let us go, because still I prepare a small presentation here. So I would like just to give you an example and to remember you that if we take a small fish and we put it in an aquarium, we have a lot of questions raising. We have even experts in the goldfish tank, because a lot of things are important for the life of this goldfish. Of course, it is just an example, but look at this aquarium. Everything is important here. Of course, the radiation, the oxygen, the small oxygen, the plants, everything that is around the small fish is important for his development. When we put this on humans, we forgot very often these elementary things. And this is what I want to show you in this presentation. The environment is important for life. It is something that is very often forgotten. So let us start with one of the most important issues at the Dead Sea, the high barometric pressure. We have about 40 millimeters of mercury more. That means that we have more oxygen here. So in which conditions, in which patients, this can be important? Of course, one of the biggest three that we have in the last decades, COPD, chronic obstructive pulmonary diseases. This condition is more and more found in the world. And I want just to show you one small slide. In blue, you have the death during 2013 in the States. And in red, we have the funding in millions of dollars. So you can see that for AIDS, the last here, we have a very few amount of deaths yearly in the United States. But the funding for this condition was enormous. I'm sure that Professor Benvich here understood what I want to show here. For COPD, we have just the contrary. It is one of the possibilities to make a change here. Of course, this is a already old slide, but it shows that for COPD, it is a kind of forgotten disease. So at the Dead Sea, we started. And already in 1998, so we are here about 20 years ago, someone wrote about the COPD patients coming at the Dead Sea, because he understood that the oxygen that we have here, it is like giving to the patient a reservoir of oxygen and giving them every day, every hour, and every minute, 6% more oxygen. Extraordinary. We saw that low altitude can improve pulmonary rehabilitation. Not only that, a little bit later on, about 10 years after, I participated to a study on specific COPD patients with cystic fibrosis, one of the most common genetic disease in children. What we saw, again, CF patients improved pulmonary function and gaining weight just by having 3 weeks at the Dead Sea. Nothing, no medicine, no injection, nothing else. Again, another paper published a little bit earlier show that even on the exercise capacity, we have results. Next already paper, I think it was a very nice paper from Dr. Blow, a brief stay at the Dead Sea make a difference. And we have the possibility to increase cardiopulmonary capacity in patients. So again, as I told you, aquarium is important, oxygen. On our life also, oxygen is important. Something else that I would like to mention before leaving this part of the Dead Sea research, it is about the medical tourism. As you heard, I think it's important for us to say that all what I'm telling here and all what we are telling to the tourists here is based on studies. And this is one of them. Not coming to the Dead Sea any time of the year, but on specific seasons. Because even for those that believe the contrary, we have also a problem of allergens at the Dead Sea. Not all around the year, but during specific months of the year, people suffering from allergy will benefit for this time in which there is no allergens. So again, this is the air. This is one of the specific climatic factors. Let us go for another one. Hypertension. We checked hypertensive patients because, as you know, maybe not, tens of thousands of people went at the Dead Sea for treatment. So we have a possibility to use a very large database. We have a possibility to talk about thousands of people, not just a small study on 20 or 40 patients. So we saw that already in 1998, Professor Sukenik and Professor Paran published a very nice paper that was a review of several papers published before, in which we saw that there is a reduction of 17 millimeter of systolic pressure and 8 millimeter systolic pressure. So the patients with hypertension are safe at the Dead Sea. You should not say, no, Dead Sea is dangerous. Not at all, the contrary. Not only hypertension, but even cardiovascular diseases. I don't want to go too much in this issue because I know that you will have here another presentation about it. But let me also tell you that other papers were published at the Dead Sea here about patients suffering from systolic congestive heart failure. These patients are very fragile. So we tried to send these patients from Beersheba to the Dead Sea. And we saw that they are also improving. So again, the Dead Sea is something amazing. Not only patients with cardiologic disease, but patients with arthritis are also likely to have a kind of improvement just by doing balneotherapy. This is a very young paper published a few months ago. Of course, prevention in cardiovascular disease is important. We have to understand that lifestyles are important to change. Limitation of stress factors, of smoking, diets are very important, and of course, exercise. So when we take everything together, we started a few weeks ago even, it is something brand new. We are developing a program for prevention of patients that are not sick. A prevention program in which patients or people who are not suffering from a disease but want to have a prevention program. They will come at the Dead Sea and benefit for all what I told you about the oxygen at the Dead Sea. Now the second part of the coin, if I can say, about skin diseases, of course, and about, something is moving here, like this, thank you. It is about the extraordinary UV radiation that we have in this area. We have less UVB, we have less UVA, we have a specific attenuation in the UVB range. This was many times studied in the past. But what does that mean? That means that in one of the most important skin disease, cancer, as you can see here, we have a possibility to better understand what is going on. Here we can see that UV radiation is the main, maybe the only one factor of development of skin cancer. So paradoxically, just in the contrary, we have a paper here published in the last years about one of the skin cancer called mycosis fungoides. This skin cancer is a CT cutaneous lymphoma. That means lymphoma from the lymphocyte. This skin cancer can be cured at the Dead Sea. This is also a paradox that a physician like me was very, very amazed to understand. Patients coming at the Dead Sea are able to improve their condition just by being under the sun. Of course, we developed some protocol of sun exposure. It is not possible to send patients like this to the sun. We have to understand how. And here at the time to remind to you one of my colleagues here, Dr. Avram Kudish, who is the one who studied all this last year, the doses that we have to use and the timing to send patients to the sun in order to have the safest way to improve their condition. So again, amazing. We can use the Dead Sea as a treatment. Extreme life condition, and we have this. The possibility to have a highly effective treatment, safe, because until nowadays we have no problem with skin cancer. We have papers about follow-up about skin cancer at the Dead Sea. Again and again, we are very happy to say that it is something very special. Now, just to tell you a little bit about the 10,000 of patients that we have, you can see here what we did this last 30 years. We receive a lot of patients, and these are the distribution. This is the distribution of disease. Of course, psoriasis is taking the big part of the cake, but also psoriatic arthritis, rheumatoid diseases, atopic dermatitis, vitiligo, cystic fibrosis, and patients with chronic pain. These patients, and this is what is very strange, are not coming from Israel. Very few. You can see here, mainly they are coming from abroad. Why? Because abroad, in these countries, they don't have the possibility to propose to them rehabilitation. So this very large spectrum of countries just reinforce what Dr. Birat said, that we have to try to cross the barriers, to make something together, because of course, as you understood, I have some colleagues in the UK, in Switzerland, I have some colleagues in Italy, and it is the way to understand a little bit more the disease. A third point, and I'm just finishing like this, I would like to bring you now a small review of a paper published very recently. But first of all, to talk about diabetes. This is an interrogation point, because we don't know exactly what happened here. But yes, diabetic patients coming at the Dead Sea can have a reduction of their fasting glucose level. And this is something amazing that we are not yet sure about the consequences, but definitively when we took two groups of patients, one sent to the swimming pool and one sent to the Dead Sea pool, we saw such changing. So it is very interesting, but this is for the future. Obesity, it is also important, because as you can see here on the next slide, it is everywhere in the world. Find your country. You see here, this is the top 10. The USA, of course, is the first. Always first. Yes, always first. Very good. I saw here Japan, 3%. You can see here. Norway, 8%. This is the percentage of patients who have more than 15 years, and that the body mass index is over 30. So Israel is not here. Yes, I think I saw Israel, no, Israel is not here, but I think that we are about here between France and Austria, I think. But again, it is an epidemic, it is clear. So why I brought this stat? Because I saw a small paper a few months ago, very interesting, just to take your mind and to try to see what can we do with radiation. This paper is about a study about mice. This is not human, clinical human studies, but just one example. They took mice that was obese. Mice were fed, here you can read, mice were fed at a high-fat diet for 8 weeks of age, and twice a week from 14 weeks, they were irradiated by UV radiation, but with 2 different kinds of radiation. One of them was UVA, and the second was UVB. The first sun lamp was 65% UVB, and the second one, 96% UVA. Why do we have to do that? What was the hypothesis? Because we know that there are influences of radiation, of UV radiation, the sun, for example, simply, on cholesterol levels, but maybe not on the obesity. And you can guess that the mice that was with 65% UVB reduced weight and weight gain, but not cholesterol and nothing else. And the group in which with only 95% UVA reduced the LDL cholesterol, the marker of hypercholesterolemia. Amazing. I think that it makes us to think a little bit. Okay, there are also the NO story about it, but the important are the conclusion of this scientist that told us that most of the effects of the sunlight are not yet known. So we have to understand, it's not just treating psoriasis at the Dead Sea. We have much more than that. And this is, I think, the message that I want to show you here. The last year, I know that I'm a little late, the last year you see the amount of paper on Dead Sea, more and more in the last decade here. We have here the way to work. This is what I want also to show. Think that health and science is connected to the Dead Sea. Surely, surely. I will go very quickly through this slide because I have no time, but just to show you that leading cause of death in world are more or less the same in 30 years. We have a diminution on the stroke, but the leading cause of death are connected also to the Dead Sea. We are doing a lot of research on this important issue, and the skin aging also has you will have a presentation about here. I go very quickly about it. A paper published in about 6 or 7 years ago. The last slide, I promise, what we want to do at the Dead Sea, with your participation, of course. COPD and cardiac disease, I think it is one of the most important fields. The second one is skin disease and anti-aging. Skin anti-aging is also very important because it is more and more requested. Metabolic diseases, as I told you, diabetes and others, and health prevention. This is a growing field. Yes, I believe that we are going to do this together. I hope, seeing this place, I'm so happy to be here. I want also to invite you to come at the Dead Sea. You are most welcome not only to be here, but also to participate. Thank you very much for your attention.